behalf of His Excellency, the President of the Republic of Zambia, Dr. Edgar Chagwa Lungu, and the government of the Republic of Zambia, I would like to welcome you all to Zambia. I would like to recognize the representatives of the Africa Center for Disease Control, Secretariat, and Southern Africa Regional Collaborating Center, the World Health Organization Afro and Country Office, the South African National Institute for Communicable Diseases, the Public Health England and PANDORA-ID-NET, and in particular Professor Zumla, a senior colleague and strategic partner of ours in Zambia, the Public Health England, the Africa Field Epidemiology Network, AFNET, the Zambia National Public Health Institute, member states represented from 16 Southern African countries, SADC member states. Today, the world faces a grave public health threat, the COVID-19 outbreak. We have seen drastic reduction in trade, in movement of people. We have seen economies slow down. But more importantly, lives have been lost. 119,000 citizens being affected globally, more than 4,000 deaths, reflects how grave this situation is. At this juncture, I'd like to commiserate with all countries that have been affected, that have lost citizens. And it is important that when Kingsmen are faced with a threat of this proportion, they meet and chart a common approach to confront such a threat. I want to make a clarion call to action to all member countries in SADC to invest in resilient health systems and promote public health security. Let us ensure epidemic prevention. Let us ensure enhanced preparedness. Let us ensure strong disease surveillance and disease intelligence activities. Let us invest in public health laboratory networks. Let us ensure that our research agenda is pitched high. Let us share information, and let us together build healthier nations, productive nations, by investing in strong health systems. Today, we convene as SADC member states at technical level to share knowledge on case management. But before we reach case management, we will be conscious of the initial steps. We must prevent the COVID-19 from coming into our jurisdictions. How do we do this? We must ensure that we strengthen surveillance, and we must ensure that we hygiene in our communities, and ensure that we forge a regional approach, taking into consideration all the fundamentals I spoke about earlier on, to ensure that the public in SADC is protected. Once we are hit, let us ensure that there is solidarity, and let us all move in to support each other. A regional approach is significant. Disease knows no border. Let us promote a continental approach. Let us promote a regional approach. Sharing knowledge is fundamental. Enhancing disease prevention at our ports of entry, be it land or air, is critical. So I make a clarion call to action for strengthened surveillance at our ports of entry. I make a clarion call to action for enhanced community engagement so that people are empowered with knowledge on how to avoid the COVID-19 infection. I am aware that the Africa Union set up the Africa Task Force for COVID response, and through that ministers meeting in Addis Ababa, called upon all the regions through Africa CDC and the World Health Organization to promote certain fundamentals in the response. I'm happy to note that this is one of the deliverables that come out of that meeting, the Africa Task Force. So I'd like to commend the Africa Union through Africa CDC, the World Health Organization, the partners that have worked with us, Public Health England, PANDORA-ID-NET, ID-NET, the Japanese government, the US government through the US CDC, the European Union, the World Bank, that have all participated in this response. I will conclude by making a clarion call to all your colleagues from various jurisdictions to lead the charge in your countries, to respect international health regulations as we face this grave threat. Let us avoid social stigma and let us approach this as a common front. Let us work together. COVID-19 will be a thing of the past, and let us now regroup and reinvest in our health systems to ensure that health security is enhanced and health systems are resilient enough to manage any future threats. With those remarks, I have the honor and pleasure to declare this meeting open.
But Public Health England is the national public health agency of the UK. It's one of the largest public health agencies around the world. We have a couple of important international projects. One is the IHR Strengthening Program, which is a UK overseas development aid funded project that is supporting the IHR capacity building in partnership with national public health agencies across a number of African countries, as well as within South Asia. So in Africa, we're supporting efforts here in Zambia with the Zambia National Public Health Institute, at the Africa CDC at a regional level, in Nigeria with the Nigerian CDC, as well as in Sierra Leone as a legacy from the Ebola outbreak, and in Ethiopia itself with the Ethiopian National Public Health Institute. In Asia, we're focused on Myanmar and in Pakistan. So we're supporting the EMRO and the CRO regions of WHO as well within this program. And we cover all 19 technical areas of the IHR, so support capacity building across them. In addition to that, we have the UK Rapid Support Team, which focuses on emergency response and responds through the WHO Global Outbreak and Alert Response Network to public health emergencies around the world, and there's a big research in emergencies capacity building program as part of that. So it is under that umbrella that we're here today, and over the next 3 days of this workshop to support this really important training workshop for the Southern African region in partnership with Pandora, the ZNPHI, the national ministry here, and with Africa CDC and WHO. We tend to provide technical input and support, and we're very happy to continue to do that. So I'll close there, but it's really exciting for all of us to be here, and we have additional people coming in to support this workshop. We've also managed to get one of the senior Italian infectious disease specialists who's currently dealing with the big runaway outbreak in Italy, coming to provide some support on the clinical case management part of the training. So we're really pleased to be here. Thank you.
Honorable Minister, sir, on behalf of the Pandora-ID-NET Consortium, may I take this opportunity to thank you, and through you, the government of the Republic of Zambia for hosting this very important training on COVID-19 at this very trying time. I would like to thank the Zambian local team for Pandora.
I work for the African Union, and I head a division at the Africa CDC. So, colleagues from Francophone countries, I say bonjour. For those from Portuguese speaking, I say bom dia. And for those from Anglophone, I say good morning. So let me once again, on behalf of John Nkegasong, Director of Africa CDC, welcome each and every one of us to this very, very important workshop, which was one of the critical pillars as far as the strategy to respond or to prepare and respond to COVID-19 is concerned.
The African Union, through its heads of states, did resolve to set the Africa Center for Disease Control in response to the weak systems that left 11,000 people dead in West Africa due to Ebola. And the Africa Center for Disease Control is structured to have 5 regional bodies. Zambia is privileged to host the Regional Collaborating Center for SADC. Now, we moved very swiftly. Again, as part of the President's transformational agenda, we set up our National Public Health Institute and started investing using local resources and using support from partners, particularly the American CDC and many other partners that have come on board. There's DFID, Public Health England, and the Japanese government and Chinese government, and World Health Organization, Africa CDC itself. So we are very strong at the National Public Health Institute, and we now engage with member states in the region. One, we invite them here to come and benchmark what's happening in Zambia in terms of health security. And furthermore, as the anchor of the Collaborating Center, we have a platform where we communicate very regularly with member states. And if we look at the pillars, in our health security structure, we have promoted capacity building for health workers in the region, for instance, in laboratory, diagnostic capacity, in case management, in surveillance. And so we've hosted a number of those meetings here. And so Zambia is ready to be the anchor for health security in the region. And working with our partners, we're also investing in infrastructure for public health security.
On behalf of the African Union and Africa CDC, especially John Nkegasong, Director of Africa CDC, we will have loved to be here. I want to thank each and every one of us for making it for this particular workshop. As I said during my presentation, the head of state have actually endorsed 5 different work streams as far as our continental strategy is concerned. And case management is one of them. And a lot of emphasis also put on point of entry. And we have been able to dissect these two key areas in the past 3 days. So I think the task ahead of us is very big. It's very, very big. If out of 55, 16 is affected already, you can see it's getting closer. So it means that it's our collective responsibility. I want to go back to Teple. He said we need what? Collaboration. We need coordination. We need communication. We need information sharing. There is no single country that can do it alone. We have to work collectively. And the best approach is regional approach, which explains why we brought all the countries from the same region together, so that because you have the same experience, you have the same, almost near similar risk. So, and in terms of response, you'll be able to do it together. So this explains why we have been able to do that.
I learned a lot about what happens at ports of entries in the way of disease surveillance and screening and case finding. I also learned how the various stakeholders work cohesively. That means port health officials, immigration officers, as well as the clinicians once suspected cases are detected. So it was very important for me to see that it's not just one profession that is involved in the preparedness and response to COVID-19. It's an integrated, multi-stakeholder approach. And that was actually quite important for me to see that, and I'm very happy that I got that out of the workshop. Risk assessment is important because it aims to address the risk of COVID entering a specific country through either of its ports of entry. So it's important in that it tries to establish which ports of entry are the most vulnerable, and that's important information to a government because it will illustrate to them what type of resources to allocate to which ports of entry.
Indeed, we have health systems that have been struggling and have inherent weaknesses, have problems with resilience. So the last thing you would want is another outbreak. But I think what has happened as a result of the COVID-19, it's given us an opportunity to examine our systems and check our level of preparedness, and also to work with partners within the countries, but also from a continental perspective to make sure that we prepare ourselves to tackle this scourge that is happening in our settings. Definitely, just because COVID has come, our health systems will not change all of a sudden, but depending upon how we respond to this and take advantage of the resources that are likely to come in, we could be able to build up our system in the area of health security, and also to try and build on the 19 core capacities of IHR and make sure that they come to the level where they can respond to anything that may come to our countries.
As part of this training, we point of entry as a key component of this workshop, and of course we also had the reference center for COVID-19 as part of the key component of this workshop. Now, as far as the visit is concerned, let me say that I'm quite impressed with the level of preparation that the Zambia authority has put in place, especially the Zambia National Public Health Institute. And of course, in terms of the isolation facility, I'm also quite impressed that within this very, very short period of time, the government has been able to put together a very, a fit-for-purpose isolation center. So one is quite impressed. And for me, I think this further underscore the need for each and every member state to have what we call a National Public Health Institute. Whether we like it or not, I think the key factor here is the fact that Zambia as a country has what we call a National Public Health Institute. And this institute has been able to drive most of the preparedness that we are seeing here in Zambia today.
I think it's a very exciting event. It's always really useful for public health to interact with clinicians. I think the level of expertise, enthusiasm in this room was really outstanding. We tried to introduce the concepts of risk assessment to clinicians, which is a rather strange way of thinking for those used to seeing patients. But in fact, it was really useful, and in a very short time people were talking about concepts to do with risk that they'd never considered before. But it is important, and I'm really pleased that session went so well. It's been a lovely venue. It's been very well catered for, and it's really good networking opportunities. And I think most of the participants, and certainly I have as a facilitator, really enjoyed the event. I think it's very useful, and hopefully it will prepare people for what may be ahead with Corona. We don't know what's going to happen, but hopefully such workshops will help.
This workshop, I think it was very important because it's important to share the knowledge. Unfortunately, my country is getting knowledge on these diseases, and it's good to share it in the way that can be like add value to the preparedness in Africa, where fortunately the problem is not so big, but of course the risk is there. So I think it's important to share the knowledge, to see how we can apply the recommendation to the different contexts, and to share idea and proposal, because it's a new disease, so it's even more important to put all the knowledge together and to see how can we use it to prevent in the African country the situation that unfortunately we are living in Europe and in Italy in particular. I was positively impressed by the awareness that I saw here, which is much higher, I have to say, than the one that we had in Italy a few weeks ago.